Right, so all this story about this great evidence for rehabilitation. What are you talking about, Helene? Where do you find this evidence? Well, if you look at the literature in the last 4 years, there have been 2 meta-analyses published. Now, a meta-analysis is a combination of all the systematic reviews, RCTs, so it's really the ultimate research. And what they have found, when they analyze people who participate in ankle studies. In other words, these are the athletes who've been injured and was on the study. So when they looked at all these research participants, look at your local stabilizers, work at your foot core, and then also very critically, look at the alignment of your hind foot. So stand behind your patient and look at the position of the calcaneus. If your calcaneus is inverting and your foot is going into supination while you're working, they're going to fall over. If the medial arch is collapsing and it's everting, you're going to have problems with the intra-articular space. All right. So I spend quite a lot of time just slowing it down, retraining, putting little markers on their knees to make sure we knock out the hip strategy, get the head in position. And this is a good athlete, but even he was battling to get that right, okay? Then I start challenging it. So I start putting a band around or something just to get them to get that alignment. And we can spend quite a bit of time with that. But only once they get this right do we make the exercise more complicated by adding weights or dumbbells and stuff like that. I spend quite a bit of time teaching them to jump, how to step down from a height, how to land, using the right strategies. All of that is considered.
Okay. All right, so what about needling in sport? What does needling do for the sports person, the weekend warrior, or the elite athlete? We think that needling would reset the muscle's hyperactive state, stimulating a healing process, and it may help to improve mobility, reduce pain, prevent injury, and enhance your athlete's performance. So we can use needling to treat muscle stiffness, tightness, free up adhesions, relax spasm, improve function. Release or deactivate chronic muscle tears, chronic trigger points, post-injury scarring, improving blood flow in the area because needling causes microtrauma. You can imagine the needle going into the muscle, probing or fishing.
Okay.
So, yeah.
Fine. Another thing is with regards to an ACL injury and a chondral lesion, how soon will you start with cycling and in turn weight bearing?
So cycling is one of the easiest thing to do and safest thing to do. But again, depends on if there is a chondral injury, it will again depend on what, how your patient presentation is. So I have one